All educators strive to create learning environments that are safe, predictable, and meaningful. However, what happens when a student engages in behaviors that question their safety or the safety of others? While most everyone agrees it's important to support our students' social and emotional well-being, not everyone is clear how best to accomplish this for most students, let alone students with disabilities. Hi, my name is Jim Fager with the Greater Louisville Education Cooperative. This brief professional learning will provide an overview of procedures and resources to support learning environments that are safe for teachers to teach and safe for all students to learn. Before we review prioritized practices and resources, it's necessary to highlight the historical approach that disproportionately and adversely impacted students with disabilities. While much needed attention has been given lately to the social and emotional well-being of students, not all the attention has been positive. The Kentucky Department of Education found a district-wide over-reliance on removals and external evaluations, commonly referred to as mobile assessments, in response to students communicating threats of harm to themselves or others. Additionally, the Kentucky Department of Education noted an absence of meaningful and articulated policy to support students in crisis. The lack of articulated policy, combined with an over-reliance on external vendors, contributed to a remove and refer approach to concerns of student self-harm or harm to others. These practices fostered a disconnect between parents of students with disabilities and schools. The disconnect was so pronounced, it was featured in local media reports. Parents of students with disabilities expressed frustration and worry that their input was not meaningfully considered by schools. Instead, decisions regarding programming needs and acute crisis response, including hospitalizations, were made largely without their input and sometimes without their consent. A closer look at the practice shed light on the problem. When students appeared at risk to harm themselves or others, it was the vendor who assessed the student. It was the vendor who determined the needs, and it was the vendor who developed a plan. All these activities occurred without meaningful input from the school, and it's the school who is responsible to ensure the delivery of a free, appropriate public education for students with disabilities receiving mobile assessments. A cycle became apparent. When a student posed harm to themselves or others, schools requested a mobile assessment. Meaningful parental input was not considered, and when the student returned from being hospitalized, vendor recommendations were not considered, and the student's behavior remained largely unchanged. This led to another crisis and school requests for mobile assessment, and the cycle repeated. The net result? A systemic response of remove and refer. Root cause analysis suggests the remove and refer practice profile was driven by an assumptive pedagogy that prioritizes student fit within the learning environment over student need. Further explanation of root causes prompted an examination of the systemic relationship between the school district and its community partners. While the district possesses rich tiered structures to support student behavior, there was no system to support school-based mental health and the coordination of mental health resources with community-based mental health services and supports. What was needed was a paradigm and practice shift, and that's exactly what happened. Two key changes have occurred this past year within JCPS that can simultaneously reduce the overuse of vendor-based mobile assessments and increase school-based safety and problem-solving structures. First, JCPS leadership prioritized building an infrastructure to support the mental health needs of its students. Now, school-employed mental health professionals are present in all JCPS schools. These individuals are licensed mental health professionals. dedicated to serving the preventative and responsive mental health needs of their students. Second, not only did JCPS employ licensed mental health professionals to staff all of its schools, as of February 2021, all JCPS schools have teams trained in the Comprehensive School Threat Assessment Guidelines. Commonly known as CSTAG, this evidence-based model is the gold standard for intervention and support to prevent school violence. With the staff and training infrastructure in place, JCPS has prioritized using school-employed mental health services and supports for students in crisis. Mobile assessments or other community-based mental health supports will become secondary, used only when school-employed mental health practitioners are not available to respond to acute student crises. Whenever a student poses an imminent threat to harm themselves, it's important that we maintain active supervision and then engage the school-employed mental health professional as soon as possible. Notify the principal and parent as soon as that's reasonably possible. Principals can request mobile assessments when a school-employed mental health practitioner is not available. Either the school-employed mental health practitioner or vendor then engages in a self-harm risk assessment and makes recommendations for supports and follow-up. School teams then will meaningfully consider parent and/or vendor inputs when developing a safety plan, as well as implement and monitor any safety plan that comes from those recommendations. Similarly, when a student poses a risk to harm others, it's important to maintain active supervision and then notify the principal or school's CSTAG lead. The principal or their designee will then engage the CSTAG decision tree, which involves evaluating the threat, attempting to resolve threats as transient, responding to substantive threats, and conducting safety evaluations for very serious substantive threats. Finally, school threat assessment teams can help develop, implement, and monitor safety plans. IDEA regulations reference the ARMS model. ARMS is an acronym that highlights key activities to support student mental health needs within school teams. The ARMS structure can be used within a collaborative model that prioritizes school-based frameworks and solicits targeted community partnerships that result in a wraparound approach for students in crisis. ARMS stands for assess. An assessment means identifying student intervention and needs, again, prioritizing the use of school-based mental health practitioners over vendors. R stands for refer. We want to refer students for appropriate services, considering first the rich and detailed supports made available through a school's prioritized multi-tiered system of support over outside vendors. Monitoring means monitoring the student's participation and problem solving around any barriers to that student's participation in the prescribed recommended services. Finally, support means evaluating additional needs that may be encumbered by the student, including the use of a behavior intervention plan. All students will benefit from these interventions. Because students with disabilities have established disadvantages, additional problem-solving structures exist to ensure meaningful parent and ARC member input, as well as equitable outcomes, especially when the areas of concern are non-academic. When problem-solving for student needs and supports is important, that school leadership consider information and recommendations presented by all stakeholders. For students with disabilities, the consideration of meaningful input from parents and outside vendors is discussed within the ARC. For example, a mobile assessment results in a brief hospitalization. Upon discharge, the student returns to school and the hospital, in turn, shares recommendations for follow-up. The ARC must consider these recommendations. While consider doesn't mean unilaterally adopt, all ARC members, especially parents, must have meaningful input in the decision-making process. The meaningful ARC input rubric can be used by ARC chairs and school leadership to assure meaningful input occurs. This rubric can be used as a guide during ARC meetings to encourage meaningful input and data offered from all ARC members. This means, in addition to special education teachers, Related service providers, BCBAs, general education teachers, and parents have a shared experience that ARC decisions are made by consensus, that all ARC members feel affirmed at having an equal voice and active role while using student data to inform educational decisions. Special education frameworks and practices strive to provide instructional supports that are proactive, positive, and preventative whenever possible. The early manifestation monitoring tool, detailed on this slide, allows the early identification of behavioral patterns. It can be used by teachers and school leadership to coach and monitor discipline events and instructional supports for students with disabilities. With these practice changes, a significant paradigm shift in supporting students with disabilities who are experiencing crisis is underway. Student fit within a learning environment no longer drives educational decisions. Instead, instructional need that cultivates safe, predictable, and equitable learning environments that consider all students collectively define the learning outcomes for all of our students. Access to this training and resources referenced within can be obtained through the QR image you see on the screen and the bit.ly detailed on this slide, or by contacting the Greater Louisville Education Cooperative.